Expectorants are drugs that can be useful in respiratory conditions where there is an increase in mucus, or when it is thicker and harder for people to raise or cough up. Expectorants typically act by either directly stimulating the secretory glands in the respiratory tract to increase the production of the fluid part of mucus so that it's thinner. Your textbook describes a mechanism that that the authors call reflex stimulation, where some drugs, and they include guaifenesin in this category, irritate the GI tract, vagus nerve, and that causes loosening and thinning of respiratory tract secretions. Now, I really couldn't find a good discussion of how it is that the vagus nerve, when it's stimulated, thins respiratory secretions. The vagus nerve does innervate the smooth muscle of the bronchi, so it has action in the respiratory tree, but from what I can tell, when the vagus nerve is stimulated, it triggers a cough. So I'm not exactly sure about the part that is in italics here. I wasn't able to independently confirm that information in your textbook, but it's very clear that some expectorants act on the glands that secrete mucus and increase the fluid component and thin it that way. In fact, that's what guaifenesin, that we know as Mucinex trade name, does. It thins mucus, it makes it less sticky, its viscosity is lowered, so it's easier for it to be coughed up by the patient. If patients feel like they have like their chest is just full and their cough is dry and they feel like they need to cough, then an expectorant can be useful. It's useful for productive coughs, also associated with cold, with a bronchitis, including chronic bronchitis. People with chronic bronchitis, element of COPD, can benefit from using an expectorant to help them thin mucus and cough it up. Any inflammatory condition of the airway, laryngitis, pharyngitis, sinusitis, where there's postnasal drip and the throat gets irritated, if there's increased mucus production, it can be easier to raise. Pertussis, we know it as whooping cough, influenza, even the respiratory symptoms of measles. These are all reasons why expectorants can be used and useful. When we are taking care of people who are using expectorants, or when we're giving them to them, we want to obviously watch the respiratory status, listen to the lungs, see if the lung is being cleared by a cough and the person isn't horribly congested. With older adults, basically any new medications need to be added with care because of the increased probability that our older adult clients will be taking multiple medications, and adding especially over-the-counter drugs is risky if there are possible drug interactions with meds they're already taking. Patients with asthma or respiratory insufficiency, when their respiratory status is just borderline, need to be careful about taking medications that might possibly actually increase the mucus production, even though it's being thinned. Patients need to be instructed to drink extra fluids if they can, if they're not fluid restricted, and most people are not, to help provide more liquid in the body to be available to liquefy the secretions. And remember, I made this point in another video that if the cough or if the chest congestion, whatever, lasts for longer than a week or so, with no relief in sight, they really should be seen by their provider. This is not something you just let go on and on and on without being under the care of a provider.